The case of sinus venosus ASD of superior vena cava type, and this image is parasternal short axis view, and in this image you see the left ventricle chamber is D-shaped, right ventricle is severely dilated. This is right ventricle, this is left ventricle, this is interventricular septum, and this left ventricle looks D-shaped, indicating a raised right ventricular systolic pressure. And this patient has got ASD and flow is bidirectional, so patient has developed severe pulmonary artery hypertension and Eisenmenger syndrome. You can see this is the main pulmonary artery severely dilated. This is right pulmonary artery, this is RPA, and this is LPA. This is main pulmonary artery, MPA. So obviously the size of pulmonary artery is much bigger compared to aorta. That of aorta, you see here, this is aorta. So indicating the severely raised pulmonary artery pressure. You can see the size of right atrium, right ventricle, severely dilated. This is right ventricle, this is right atrium, nomenclature, right atrium, right ventricle, left atrium, left ventricle. This is the case C. This is moderate TR. Now see it. You can see this is ASD and flow. You can see this is blue flow across this, the flow right to left, and see. Now see, this is just red in color, so flow is left to right. The flow is bidirectional, mainly right to left. So ultimately this ASD has developed Eisenmenger because patient is old lady. ASD was not previously diagnosed and patient has developed Eisenmenger syndrome. In this image you can easily see this is blue flow across the ASD. This is ASD, sinus venosus ASD of SVC type. This is ASD, and now you see the blue color here indicating flow from right atrium into left atrium. That is reverse flow. And next you see the red color. I want to show you red color. This is SVC. This is flow of SVC, superior vena cava, and SVC also receives flow from right upper pulmonary vein. So whenever you find sinus venosus ASD of SVC type, you will get a right upper pulmonary vein flow into superior vena cava and ultimately into right atrium. I want to show this. Now see, this is the red flow. So red flow across ASD, that means flow from left atrium into right atrium. That is normal flow. So you get red flow and you get blue flow. You get red flow, this is this red flow from left atrium into right atrium, and blue flow from right atrium into left atrium. So ultimately this ASD has developed bidirectional flow. Ultimately patient has severe pulmonary artery hypertension, bidirectional flow, right atrium, right ventricle, and main pulmonary artery severely dilated. So patient has developed Eisenmenger syndrome with sinus venosus ASD of superior vena cava type. Again you see the same thing. Trivial to mild mitral regurgitation jet also seen. This is the place where you see the jet. This is the flow across main pulmonary artery, flow across pulmonary valve. This is flow above the baseline, that means pulmonary regurgitation jet. The pulmonary regurgitation jet, you can see the peak velocity is approximately 3 meters per second. That is very high. Mean pulmonary artery pressure is very high. You can see the mean pulmonary artery pressure is likely to be 36 millimeter mercury. That normal pressure is less than 15, but in this case is 36 millimeter mercury. So indicating again the severely raised pulmonary artery pressure. Again see the LV chamber is D-shaped in nature, indicating raised pulmonary artery pressure and raised right ventricular systolic pressure. So this case is sinus venosus ASD of SVC type, bidirectional flow, Eisenmenger, right upper pulmonary vein draining into vena cava. One thing I want to highlight, that this type of ASD is best seen in subcostal view only. Sometimes you may find it in apical four-chamber view, but the best view to find out this type of ASD is subcostal view. And subcostal view you will find this kind of ASD. So this kind of ASD, just try to trace out interlateral septum, most superior part of interlateral septum. You will find ASD where the vena cava drains into right atrium. Thank you.